Hi, Chief.
Morning, Helen. How you doing?
Excellent. I'm in my studio now, so I can even paint while I'm eating, which makes me apt to listen even better than I usually do.
I was going to say you have a different background today.
Yeah, I'm learning how to use Tim's laptop. Okay. You know, I don't remember. Hi, Kathleen. You're muted.
Okay, hang on.
There, I can hear you. Good morning. No, now you're muted again.
I'm unmuted.
Yes, you are. Hi, Courtney.
Good morning, Helen, and everybody.
Good morning, Courtney.
Well, it's sort of nice to say good morning, you know?
Everybody.
Good morning, Courtney.
It's sort of nice to say good morning, you know? Who is Glapence? Is that Detective LaPence?
Yeah, I'm guessing it is Geraldine.
Yeah, that's Geraldine.
Yeah. Hi, Jeannie.
She will not unmute herself to say hi, but I'm sure she's waving back.
Yeah, good. I never get to see you all.
Yeah.
It's okay.
There's nowhere for you to go if you don't tell him what has happened.
Telling the truth, period. I've never cheated with anyone at the store.
Well, let me say this, Ms. Palmer. Today may not be the day that you feel like you want to tell him whatever you need to tell him. But at some
Hi, Suzanne. You're muted. That may be good.
Good morning, Helen. How are you?
I'm good. And good morning, Mike Travato. And good morning, Susan Reverby. And oh my God, this is like a party in my studio. Lieutenant, detective. Oh my God. Chief Polly. Oh my goodness. Hi, Mike. Hi, Justina.
Hi, Helen. Hi, Suzanne and Kathleen and Courtney.
Good morning.
It's a party.
Morning.
Yeah.
Good morning, Courtney. It's Chief Pauly.
Good morning. Are you ready?
Yeah, I'm ready. I was just going to ask you if you were.
Yep, we're all set.
Okay, thank you, Courtney. Good morning, everyone. Today is Tuesday, May 5th, 2020. This is the weekly meeting of the Emergency Management Team for updates. This is Rich Pauly, the Fire Chief and Co-Emergency Management Director. And I see Chief Hurley's out there. Chief?
Morning, Chief. Thank you. It's good to see. Looks like we have 61. We have 61 participants today, so it's good to see. Good morning.
Okay, so what we'll do is we'll follow the agenda that we have followed right along, starting off with the Health Department, and then if Outer Cape Health Services there, we'll ask for an update for them. So Hillary, you're up.
The governor's order on face
Hillary,
masks
can you start
or
over?
face?
You were muted.
Oh, I'm sorry. Okay, can you hear me now?
Yes, we can.
Yeah, okay. Okay, perfect. So I was going to talk this morning just about the new governor's orders on face masks or face coverings effective on May 6th, which is tomorrow. So what it says exactly is that any person over the age of 2 who is in a place open to the public, whether be it indoors or outdoors, and is unable to not maintain a distance of 6 feet from every other person shall cover their mouth and nose with a mask or face covering. So that's important because it does say indoor or outdoors. So, and you cannot maintain a distance of 6 feet. So it's both of those situations. It says that a mask or face covering that covers your mouth or nose is required. The exception is if there is a person who is unable to wear a mask or face covering due to a medical condition, or if there is a person that has been exempted by the Mass Department of Public Health. It applies to all workers and customers of businesses and organizations that are open to the public. If a customer refuses to wear a mask or face covering for a non-medical reason, a business does have the right to decline them entry into their establishment. The order, as it's provided by the governor, is enforceable by the local health department. We can request assistance from the state if it's needed, and from the police department if it's needed. So the first line here is to the health department. If folks feel there are violations of this, they can feel free to call our office or send me an email. We will attempt enforcement as we do with all complaints that come in. So violations to the order can result in fines of up to $300 per day. We clearly do not want to be fining people or getting into altercations with folks, but it is important that everyone do try and wear their face mask or their face coverings. We still have them available at the health department. Folks can reach out to me. I've put a number of them outside my door for people. They've picked them up. They're lovely. They are the cloth variety. Some tie, some go behind the ears, but we do have more available for those in need. We have some for children as well. So if you're going to reach out, let me know how old your kids are and how many you need, and I will put them outside my office door on Wednesday, tomorrow, for you to pick up. In addition, we do have a Facebook page that we are sharing with the town of Truro. We're just getting that up and running. It can be found under the Town of Truro and Wellfleet Health Department. We'll be posting guidance, and we will be featuring our restaurants and retail shops pretty soon. So we're working on guidance for those folks. We've been in contact with most all of them, and folks are beginning to open up and they're getting excited to try things a different way. So be on the lookout. And I think with that, I'll close for the moment.
Okay, thank you, Hillary. I don't know, is Otter Cape Health on the meeting this morning? Is anyone from Otter Cape Health?
Yes, I'm Lisa Kane. I'm the Wellfleet Health Center Director. I'm here.
Hi, Lisa, could you give us an update of how things are with you folks?
Absolutely. Thank you for including us. I know Pat was on the call. Pat Nadel, our CEO, was on the call last week. I wasn't able to be on the call, so I'm not sure exactly the things that she covered. I welcome any questions that anyone might have. Not a lot has changed over the past week. We're continuing to do our COVID testing here at the Wellfleet Health Center. The numbers of tests that we're performing are fairly stable. You know, it varies from day to day, but we haven't seen a dramatic change, a dramatic increase or decrease in the number of tests that we're doing. Our Quest laboratory here in our building, they are providing Quest direct access to the antibody tests that people have heard a lot about. We've been getting a lot of questions from our patients about this antibody test, and there still is a lot to learn about it. But that test is currently available both with an order from your healthcare provider, and patients are able to go directly to Quest and request that test without necessarily going through one of our healthcare providers. They will pay out of pocket. If they choose to go that route, it's $119. If they go through their healthcare provider and get an order, then there's no out-of-pocket cost for patients in that case. So we have had, some of our providers have been ordering this test, and we're still learning a lot about it. We don't currently know what the results of that test mean in terms of immunity from infection by the coronavirus. So our providers are, you know, learning quite a bit, as everybody is during this time. I think we feel as if our numbers of patients who are testing positive has flattened out. We're not seeing a dramatic increase in the number of positive tests in our communities. And I think right now we're feeling fortunate that the numbers are relatively low in the Outer Cape communities. We remain well supplied with personal protective equipment. We've gotten a lot of support from the state in that regard. So our healthcare providers and staff have plenty of access to the appropriate personal protective equipment. Does anybody have any questions?
Yes, we do have one hand raised. I'm going to let Mike DeVasto go and then Helen, and then I'll get to the chat. So Mike, you are unmuted.
Hi, Lisa. I had read a report that there's a lot of, there's like 500 different antibody tests that are out there, and a lot of them have false positives going on. And I'm just wondering, do you know what the false positive rate is on what you guys have available there, or any information about which ones are reliable or not as far as antibody testing,
right,
so people don't go and think when in reality they've never actually been exposed to it.
Right. So the test that Quest Lab is providing, they've given us some data from the manufacturer of that test that it appears as if it's a fairly specific antibody test, meaning that it is doing a very good job at identifying this specific coronavirus versus potentially picking up other coronaviruses that are out there. And there are many, many of them. I'm really not familiar with specifically which tests are the best or less than ideal. Really, all that we are utilizing right now is the test that Quest is providing. And our providers, I think, have a pretty high degree of confidence in the specificity and accuracy of that test. But again, it's really very new. We have tested patients who had suspected that they had COVID, even though their initial swab was negative. And we've had a couple of patients that did come back positive with positive antibodies. We've also had a number of patients whose tests have come back negative. And again, I think one of the most important things I think everyone should know is that we don't really know much about what exactly these test results mean. We know that patients need to wait approximately 10 days after their symptoms have resolved before they get this blood test. So the timing of having the blood drawn can have an impact on the results. And again, we're still learning quite a lot. But it's a very good question, Mike. Thank you.
Okay, thank you. Next is Helen Wilson. Helen, you're unmuted.
Hi, this is for Hillary and Outer Cape Health in general. So I have a friend who is gotten accredited by she and a couple of volunteers in Provincetown to hand out masks at Stop and Shop. This is last week. What is the name, Hillary, of the organization here? It's got 3 letters. I'm bad at this kind of thing. The health organization, the M something.
Is it the Medical Reserve Corps?
Please.
The Medical,
yes, thank you.
Medical Reserve Corps?
Yeah. These volunteers have, they have a badge and they got, in other words, they're going to the places, right? They're going to be people that are coming into town from elsewhere. And I'm particularly thinking of the beaches. And even though people can space out of the beaches, that doesn't mean that the bottleneck, as Mike DeVasto once very clearly and well described it at the parking lots, isn't a situation. or at the marina, or at any of the places on Main Street, which we hope will be more open. And is there any possibility of, given that there would be decent volunteers, when the crowds start coming, and we hope they will come up to a point, that we could organize that kind of program here? In other words, it wouldn't have to even go through the town. It could go through this other group. Has any thought been given to that? Because apparently it was very effective in Provincetown. People took the mask, people were going in without masks even now. Now it's the law, right? But that doesn't mean people have masks.
Well,
So that's a
I guess
question.
what I'm seeing, yeah, I mean, we can give that some thought for sure. We're not seeing that many people requesting masks of us. I mean, we get requests, it's fairly constant, but I haven't seen a huge uptick this week in comparison to last week or the week prior for folks needing a mask, and the order does go into effect tomorrow. So I would also hate to see folks kind of taking them and then just tossing them aside because they don't really need them just because they're available.
Yes, I understand. However, most people that just come in here won't be able to get them from the health department because you have your hours and they don't even know where the health department is, and they're not, they're here like the 7 young people on the beach the other day. And they have no way of, without masks, they have no way of knowing where they can pick one up. That's all. It was just my thought. Maybe I should go and look into it more.
No, I'm happy to consider it. I don't know that the Medical Reserve Corps will want to have volunteers stationed at our beaches every day of the week. I mean, we can reach out to them and have the conversation.
Or just on Main Street. Thank you.
Hillary, if you don't mind, if I could just step in for a quick second.
Yeah, go ahead.
I had that conversation with the Provincetown group. I've been looking into that buddy system, buddy line, warm line that it's called. That group that Helen is referencing was vetted by the Medical Reserve Corps through Barnstable County Health. Fortunately and unfortunately, it took them several months through organization, going through town, I don't want to call it approval, but town steps. And then they're a very tight-knit group of medical professionals, both active and retired, who are willing to man that telephone line and pass masks out. So during my segment, I was going to put out an ask within the community if we have any current medical or retired medical professionals who would have any interest in that type of group in Wallfleet. Unfortunately, the Provincetown group has kind of expanded into Truro, but I don't believe they can handle Wallfleet also. But that vetting through the Medical Reserve Corps is it's a federal program, so it's a pretty substantial vetting process. I was going to mention it later, but I figured since Helen brought it up. Thank you.
Okay, thanks. Lisa, these are a couple more questions on the chat for Outer Cape Health. Is it a walk-in basis for antibody testing at Quest or by appointment? And is this for all locations?
It is available at all locations, I believe, and I can forward you the link that I have for the Quest Direct Access. Can I email that to you, Courtney?
Yes, you can email that to me and I will put that into the notes for this call.
Great.
Okay, and
it's not walk-in. You do have to sign up for it first online, and then I believe they schedule a specific time to come in, and the patients have to be symptom-free for 10 days. They obviously want to keep their Quest staff safe, so that if patients were were suspected of having COVID, they need to be symptom-free for at least 10 days.
Okay, thank you. The next question is, how is Outer Cape preparing for the post-Memorial Day increase in numbers on the Outer Cape?
Another great question. We are certainly anticipating that summer visitors are going to continue to come in some numbers, and we are actively making plans to make sure that we have adequate staffing here in the health center to accommodate those visitors. Our hours have been reduced during this time to minimize people coming in contact with each other here at the health center, and we're working hard to keep people using telemedicine, video, and telephone visits to keep people at home when it's appropriate to do so. So we are having meetings twice a week with senior leadership to talk about what our hours are going to be in the very short term as we expand more access, and also rolling forward as we get past Memorial Day and approaching the 4th of July, to make sure that we have appropriate hours and availability and access for our summer visitors and the community members.
Thanks, Lisa. It looks like, okay, Select Board Member DeVasto, and then also Select Board Member Carlson, and then we should probably start moving on if there's no more questions. So Mike, go ahead.
Yeah, I just wanted to speak to what Helen was talking about availability of masks. The new order from the governor requires face coverings, so people can use bandanas and cut up t-shirts. Anything that's a face covering applies to that. So if you can't get a mask, there's ways to cover with pretty simple solutions, a bandana being one of them. So I just wanted to bring that up. You do not need to have a actual stitched mask. And the point is that you are restricting the aerosol from your own mouth to protect other people. So anything that will sort of keep your breath to yourself is the point of the order. It's not about having N95 masks and being in close contact with high viral loads or anything like that. So I just wanted to throw that out there, that you don't need an official mask.
Yep, and the information from the CDC on any type of face covering guidance has been on the town website for a few weeks now. It is still up there, and that information can be found online. So Justina, we'll go to you. You're on.
Thank you, Courtney. A quick question for Lisa. When you said that you're starting to make plans, actively making plans for the summer, are you planning to hire more people, and is there the budget to do so?
We haven't gotten to that part yet, so I don't have a specific answer to what our exact staffing plans are, to be honest.
Sure.
Healthcare organizations all, yeah.
Thanks.
Good question, though.
Tough question.
Tough question.
Okay, Chief Pauly, I'm not seeing any other questions, so.
Okay, very good. Thank you, Courtney. Lisa, thank you very much again. This is the second time we've had you folks on here, and it's been very, very helpful and certainly informative. So we really appreciate that.
Absolutely. I plan to stay on the call till about 11, and then I have another meeting. So I'm happy to join each week. Thank you.
All right. Thank you very, very much. Next is Department of Public Works. I'm going to go with Mr. Norton because I see him up there. Jay?
Yeah, Chief, it's Mark. I hope you can hear me.
Oh, I'm sorry. Go ahead, Mark.
Yeah, I apologize for that confusion. Yeah, I'm here regarding DPW. Other than the normal department functions and updates that are on the website, I just have a quick update on the transfer station operation. As of yesterday, we're able to accept single stream recycling, which includes glass, cardboard, mixed paper, plastic containers, and tin cans in one source at the transfer station now. I just want to thank everybody for their patience and cooperation until we got this up and running. Again, this is a trial. We have no reason to believe right now that it's not going to be successful, but we wanted to make it safe for residents and employees. So like I say, other than that, we periodically update the website with other functions that we're doing right now to prepare for the summer. But really, other than that, Chief, that's all I have for right now. Thank you.
Okay, thank you, Mark. Jay or Mike, anything to add for DPW?
Mike, Mike.
Yeah. Hi,
I think
Chief.
you
This is
said
Mike.
something
Thank
about-
you.
Sorry, go ahead. Go ahead, Mike.
Oh, I just wanted to thank everyone for their patience and cooperation with all the things that we've been trying to do up there recently. And we've got recycling open. We just want to get that off the ground, make sure it runs well the way we expect it to. And we're going to focus on everything else reopening at some point when equipment comes and whatever the state of the world is at that point. So thank you all very much.
Okay, thank you, Mike. Much appreciated. I'm going to move on to community services. Suzanne Thomas.
Good morning. Right now, the activities at the senior center are status quo. We are into our third week of delivering hot meals to over 50 people on Fridays. And a shout out to dispatcher Emily Miller, excuse me, of the Wellesley Police Department. She's one of our liaisons. She has done a great deal of work on this and actually enlisted Sergeant Turner to be with her one of the delivery vehicles this week. So that'll be a learning experience for Sergeant Turner. A lot of focus on the beaches, a lot of focus on how do we keep it safe, how do we keep it sanitary, what can we require of people, what we need to just inform and advise and recommend. The American Red Cross has recently come out, just yesterday I got the email, about not having traditional swimming lessons where the instructors actually touch the children, but having a format of lessons where there's a family member in the water with the child. So we're going to be investigating that for this summer at Gull Pond. Barnstable has canceled their swimming lessons for the summer. I think a couple of other towns are leaning in that direction. Becky and I are going to have that discussion after the 18th when we see what the governor's guidelines and the governor's commission's guidelines are, if any. Same goes for morning rec, trying to have it create a morning rec at Bakersfield that is safe. Will be a challenge. Now Becky's working hard on creating accommodations that will let us do that. I think I said last week, the beach sticker office will be closed to the public this summer. It'll be available, all stickers will be available online only. For those handful of people who don't have internet access, I can arrange a mail-in opportunity, but the preferred method is online. And over the weekend, I was processing online sales, and total of Friday, Saturday, and Sunday, which were all residents and combination stickers, was over $7,000 for 3 days. So people are ordering their stickers. And I think everybody is anxious to get out into the sunshine and near the water and in the water. So we're going to try to make it happen in some form and as safely as possible. And that's about it.
Thank you, Suzanne. Is Becky on the line? Yep, I see you. Hi, Becky.
Here, Chief, can you hear me?
I can. We can.
Hi. Okay, good morning. Just real quick to just enhance on what Suzanne just said. Like all the rec departments on the Outer Cape, the department is awaiting guidelines from the state as to the operation of town-sponsored recreation programs, events, and facilities. As soon as these guidelines are received, we will evaluate what will work within our specific situation in consultation with the town's emergency management team. In the meantime, the department is exploring constructive ways to offer virtual versions of popular summer programming so that we can continue to reach out to the community with familiar faces and activities. Our ongoing virtual events include square dances, disco night, family fun dances, and capoeira and soccer classes. And those are available on the Google Meet platform. All of the links are on the town website, also on our Facebook page and Instagram account. We're adding concerts by local bands on Facebook Live on the Wellfleet Rec Facebook page. So if you're interested in that, please like us on the Wellfleet Rec Facebook page, and we'll be getting some local music out there. We had Sarah Burrell last Saturday night, and over 100 people tuned into that on Facebook Live. So I think people enjoy hearing from the local musicians as often as possible. So we're sort of at the mercy of the guidelines for now, but as soon as we know, we'll post it on the Facebook page and get the word out to people as to what versions of virtual versus live recreation programming will be available in Wellfleet. So that's all I have for now, Chief. Thank you.
Okay, thank you very much, Becky. Just a couple brief things from the fire department. Open burning season did close on May 1st, so last Friday was the last day you could burn outside, and that has not been extended by the Commonwealth. We are in very good shape for personal protective equipment. However, I think the mindset now, at least I know from myself and Chief Hurley and a lot of public safety people, is that we'll never have enough personal protective equipment because we don't know what the future is going to bring. We are preparing and gearing up for the summer season, obviously, but this, as I said before, this is going to be a very different summer season. While we may have some reduction in population of summer visitors or summer residents, I firmly believe that people are going to still want to come to the Cape, and I understand that. So, you know, we are really struggling with how do we provide emergency services, fire, police, rescue, still in the grips of some type of pandemic. I've been reading several studies, and there is some belief, and this is still very preliminary, but there is some belief by a couple of public health experts that we could be seeing an uptick in June. Whether that is a second round of the virus or just with places opening up, states opening up, and people becoming more mobile again, that we are preparing for that possibility. And I don't want to be spreading doom and gloom, but basically this is what you pay us to do, is to prepare for this. There's a lot of behind the scenes activities, projects that are going on right now. You heard a few of them from Public Works, certainly through the beach department and community services. That is happening in every single department in this community. We are all preparing for the summer, and we're all preparing for a different summer still in the midst of potentially of a pandemic. So that's all I have right now. Again, if you need us, don't hesitate to call us. And I will turn it over to Chief Hurley.
Thanks, Chief. I appreciate it. Again, a quick brief update this morning. I mentioned earlier during the conversation with Out of Cape Health, just investigating the buddy system in Provincetown, warm line as they call it. A few things learned about it. It is not a 24/7 staffed line. They staff it 11 a.m. to 7 p.m. with a very strong group of volunteer professionals who are currently in the medical profession or retired or have come out of retirement to help through this. And again, they're just a short-term gap just to fill the holes to have a number for people to call. So I just put a word out within our community if there is possibly a group of people or individuals who may have some type of interest in this, if they could reach out to me. And I mean, the Provincetown group has done a phenomenal job, both organizing, working with the Medical Reserve Corps, who they're vetted through, which is run out of the Barnstable County Health Department. And it is a federal program to get their credentials and to be able to speak with people through crisis and so on. So I just want to put that request out there. My dream would be to have some type of hotline here in Wellfleet. However, we do have many other resources, the Good Samaritans, NAMI, and the state's 211 line But I know there's a lot of people struggling, and as we continue to go through this, we see an uptick in population is going to raise more anxiety throughout the community. I would like to see if we could get something in place. So still a work of progress. However, again, if anyone is out there, please reach out to me and maybe we could get something started from there. Thanks, Chief. I appreciate it this morning.
You're welcome. Thank you, Mike. Next is the town administration. I'll go with Mr. Hort and then Mr. Travato and any of the select board select board members. Dan?
Good morning, everyone. Just a few updates here. We continue to have we have a joint call coming up with the Outer Cape Town managers and administrators and select board chairs to discuss a cohesive reopening strategy for the Outer Cape. I also have a joint call with the Outer Cape Town managers, administrators, and the Seashore to discuss beach-related issues. So it's ongoing, an acknowledgement that we all kind of need to work together on how we do this so that we're not, that every town doesn't have a different strategy. For those of you who are asking about short-term rentals, we don't have an answer there yet. And I realize this isn't optimal because you are caught in the middle here, but we're waiting for guidance from the governor's office as to how we do this. If the governor says that it's appropriate for short-term rentals to be allowed again, the town does have the option of restricting that if they so choose, if they feel it would be a health concern for the Outer Cape and for our town. So it's a fluid situation. We don't have an answer yet. The town election is going to be June 15th. I just sent our town clerk an email to ask her when information would be ready. We will have all of the elected races, none of which are contested, on the ballot, and we will also have 2 advisory questions that came from citizen petitions. So what we will try to do once we have the ballot ready is we will try to do as much of this as possible by absentee and early voting so that actual in-person voting on June the 15th will be very limited to keep everybody safe. Town meeting is scheduled right now for October the 5th. And lastly, I just wanted to bring up something we've talked a little bit about P-Town, and because I live there, I noticed a disturbing trend over the weekend, and it's been commented on social media by a number of people that there were large groups of mostly younger people in town enjoying a beautiful sunny day, and they were defiant in that they were not going to wear masks. And people would remind them that they need to be wearing a mask or a face covering, and they would become belligerent. One to-go place has even considered not opening anymore because of the large crowd that it created of people refusing to wear masks. And it's a disturbing trend. You know, I look at it and I say, okay, is that going to be what happens when we get to the summer and the beaches? So I think we all just need to be vigilant. I don't have a solution here, but we need to be vigilant. We can't make the police our sole enforcement. Sometimes common sense has to prevail, but over the weekend I didn't see a lot of common sense when I was out for my walks. So I think it's just something to be aware of. With that, I'll turn it over to Mike Travato if he has anything you'd like to add.
Thanks, Dan. As I mentioned last week, we continue to develop a plan for the eventual reopening of town offices, both physically and virtually, with social distancing and safety in mind. And we'll keep folks posted on what will look like going forward. And on a personal note, I just want to publicly acknowledge the hard work and effort under duress of not only the emergency management team and all of town staff, but specifically the leadership of Dan Hort and Chiefs Hurley and Polly, as well as the select board, as they have a lot of difficult decisions in front of them going forward here. And at the risk of singling some people out, I just wanted to give special recognition to Hillary Lemos, our health agent, for keeping the town safe. She's been on top of this since the beginning, working with the Department of Public Health on guidelines for us. Right now, she's working with the restaurants, as she said, and the businesses and trying to get them open when they're able to. And I also want to acknowledge Suzanne Thomas for the beaches. For the last 2 years, she's had to deal with sharks and now dealing with a pandemic. Suzanne, I'm sure you didn't expect that the dealing with beaches was going to be this difficult, especially in the last 3 years. So that's really all I have to offer today. Thank you.
Thank you, Mike. Any of the select board members have any thoughts? I see Kathleen.
Am I unmuted?
You are not. You are now. Yes.
I have several questions. I'm going to start with Suzanne Grout Thomas first. This came to us, and I'm sure you saw the letter as well from Wellfleet resident John Morrissey. How can we possibly keep our public restrooms sanitized over the summer months? In a reasonable fashion. Are you thinking about that going ahead, Suzanne? About how we're going to be sanitizing the public bathrooms and porta potties?
Actually, Mark Vincent and I have been discussing this for a few weeks and have come to the conclusion that even though it's difficult, it would be easier to keep portable toilets sanitary than the sort of aging cinder block constructed public bathrooms. To that end, I have been talking with Mr. Hort about putting portable toilets at all locations with hand washing stations. And the number of hand washing stations would depend on the number of spaces in each parking lot. And to have the portable toilets pumped and sanitized twice a day.
Okay, and to that end, going with the porta potties, in increasing that expense for the town, and this just might be a long shot. Is there any chance that we could get a grant, a state grant, to help us with the cost and the expense of porta potties across our beaches?
Well, part of the answer is because we would be using portables and not a private cleaning service, the money that's allocated in the DPW budget for that cleaning service could be transferred laterally to portable toilet costs.
Okay,
and the answer to the second question is, I don't know, I haven't looked into it, but there's an emergency funding for public safety type of grant that would cover part of it, which I will investigate.
Can I jump in for a second on the sanitizing and portable toilets? We did ask the question back to the county if there are better ways to sanitize these things, get some guidance and protocols. We might need to require folks wearing their masks into the portable toilets, making that a requirement. I don't know at this point in time how we would police that, but there are some concerns with small confined spaces in this virus. So we are actively seeking more guidance on that. And along those lines as well, we are working on additional new signage for the beaches. Some of it depicts wearing a mask when you get up to walk, not necessarily wearing it when you're sitting on your beach chair 6 feet apart from everybody, but when you go up and down the ramps, you need to have your masks on. So we are going to have guidance on that and signs available when we get to that point. They're just still in the development phase.
And Hillary, while I still have you there, you were on my list. I'm seeing a complete disregard, particularly in the neighborhood where I live, for people that are arriving and are not observing a 14-day quarantine. For them, this pandemic doesn't exist. I'm going to keep saying it. I'm astounded at the level of denial with what I'm seeing out there, as Dan mentioned what he saw in Provincetown, but to be living in a neighborhood where people are arriving to open up their houses and they're not quarantining, I don't, any way to enforce it. I'm just trying to keep my mouth shut here, but I don't like what I'm seeing either.
I think we all observe that and we all understand that that's going on. But unfortunately, the quarantine is the advisory, and it's, you
Yeah,
know,
I get
very
it.
difficult to take any enforcement on that front. If we could, we would try to, but it doesn't seem, you know, like we can. The best we can do is put out to people, bring your supplies with you and limit your outings into public places.
Thank you. For Mark Vincent, Mark, are you there? Mark or Jay? Courtney, can you get me Mark Vincent?
Jay is on and he's unmuted.
Jay, again, I'm asking about making the harbor walk one way before we get to Memorial Day. It would just require some signage. But again, going down there this week and observing people that are using it while they're social distancing from one another now, that might not be the case once the season opens up. So again, I'm asking about what we can do to make that walkway, you know, one way only, and put some signage up with regard to social distancing. It's a great spot for people to go, and they're going to go there. So I don't know.
Kathleen, I know we were coordinating with Mr. Hort on that, and I believe he reached out to Will from the harbor. Dan, I don't know if you wanted to update on that.
Good morning. The harbor master's office didn't feel that it was necessary. I think I will kind of overrule that decision, and we'll do what we need to do to make it a one-way walking. As more and more people are there, I think we need to take every precaution possible, and that will be one of them that we'll take care of.
Right, thank you,
Nancy,
Dan.
this is Nancy. Just 1 second. If I could just say, we have not noticed problems down on the pier with this. We have not had any complaints come into our office, and as far as I'm aware, not into the harbor master office either. The main problem that I see on the walk is dogs defecating and their owners leaving it there. I got really mad the other day because this is something that the harbor masters spend the first half hour of their day doing year round. That is more of a problem than people walking. People are great down there. And I don't see the problem. I understand what happens on Facebook, but I hesitate to make decisions based on what's happening on Facebook. But I just wanted to put my 2 cents in on that one. Thank you.
Right. Chief Paul, I have one last question for Lisa Kane from Outer Cape Health. Lisa, are you still on the line?
I am still here.
Kathleen Bacon here from the Select Board. I'm asking about contact tracing and you know, where you are at with that. I think that going forward with regard to opening up the Commonwealth, Governor Baker is putting a lot of effort and money into contact tracing. Can you tell me if that is started with you yet?
We're in the process of training our staff to begin that contact tracing in collaboration with Partners in Health and the Massachusetts League of Community Health Centers. So we are ramping that up. We have not officially started doing the actual contact tracing, but we're very close to being finished to training all of our staff so that I'm pretty sure we will begin later this week or the very beginning of next week.
Can I chime in too? Because we currently do the contact tracing. It's done by the health department. And so the way that this CTC is going to work is that the cases still come into the health department locally first. And then if we are overrun and we cannot handle it, then it goes out to this larger group of contact tracers to follow up on. We have until the end of the workday to reach out and make contact with these folks. Our intention is to continue to do that from the health department until and at such time when we become overrun, then it just goes right out to the contact tracers. So just so you are aware, we still do get the information first locally in the health department.
Thanks. Thank you, Hillary. Chief Pollard, that concludes my questions for this morning. I want to thank everybody for all the work that they're doing, and we'll get through this.
Thank you, Kathleen. I'm gonna, Ms. Wilson, do you have anything? Helen?
Yes, I do. So people are now going to start to get tested for antibodies, and that was a very good walkthrough as to how reliable they may not be. But is tracing also going to happen with people who have antibodies because they may have had symptoms and been vectors, but the symptoms may have been almost not discernible? Is the tracing also going to apply to people who test positive for antibodies for this specific virus?
If they get logged into the system, then we follow up on them.
Even if they haven't been diagnosed with COVID, but they have the antibodies?
I think we would have to understand the test and see how that gets logged into our system.
Okay, now I have a second question for Dan Hort, if he's there. Dan, are you there?
I'm here.
Hi. So last time, last emergency management team meeting, I think, or was it a select board meeting? Who can remember? I said that I thought it was really important for the different groups on the Outer Cape to be working together, and also with the park to coordinate what we were all doing, particularly with relation to the park that sells, passes to beaches that, are on the entire Outer Cape. And you just mentioned a meeting that was coming up with different town managers, administrators. My first part of the question about that is the park being included? That's the first part. And the second part is, you mentioned just the chairs of the select boards. Now, I would trust Janet to go to that anytime, but I was the one who brought it up first. I mean, we've all been thinking about it, not an original idea. And is this going to also be available to other select board members? I would really like to hear what is going to happen at that meeting. Is it an open meeting? Is it going to be recorded? How do we deal with it? So 2 questions about that for you, Dan.
The National Park Service is arranging for a conference call. They do it every other Thursday. So they are leading the charge of talking about beaches and parking. So they are absolutely involved in this. The second part of your question regarding the chairs, it's being set up by another community, and I can ask them whether they would allow other people to listen in on this conference call. I don't have that answer yet. I'll have to check with them.
My point about that is our select board would then be making decisions. And we need to be able, after that, and we all need to be able to understand what the exchange was like. So I'm really hoping there will be at least an audio recording of that available on the town website. Thank you.
You're welcome.
Chief Polly?
Can I just go with Ms. Carlson and then Mr. DeVasto?
Am I unmuted?
Yes.
Again, thanks to everybody. My first question is to Suzanne. When you said the beach sticker sales are online now, you mentioned it was for residents and accommodations. What's accommodations?
It's accommodations for people who do not have internet access is what I was referring to.
Okay, great, thanks. My
You're
second point, yeah, thanks for everything, Suzanne. My second point is to Chief, picking up a comment that Chief Polly made about how our hardworking fire and police and other departments are going to have to deal with the summer influx of population. I think this is something we have some local control over. I know we're waiting for the governor's next directives, but we have particular needs as a community, and he's dealing with the whole state. I read the recommendation to his office by the Bain consulting person. It's you can get it online, and there wasn't anything in there towards some of Wellfleet's main concerns. So I do think the select board is going to have to deal with short-term rentals because it keeps our population down. And I think that's my position. I think that although we have to wait for the governor's office, we also have to have our own concept of what's best for our community to keep our residents safe, because I think we've got great numbers because we did great work as a community. And I don't need to remind anybody that not only will our population go up, but something like 97% of our short-term rentals come from people who can drive here to the Cape. So that means they're coming from hotspots, New York, Boston, from national hotspots. So I think, unfortunately, we have to think boldly for our own community to keep our community safe and keep community spread down. So any input at any time from the emergency response is always useful for the select board.
Okay, thank you, Justina. Is that all you have right now?
Yes.
Thank you. Okay, Mr. DeVasto.
Yeah, I just want to make a couple points here. The state's plateaued, but we're nowhere near where we need to be to start opening for leisure travel here down here on the Cape. And you know, we were in desperate need of emergency response when we first started, but I think we're transitioning into a point where we need to start focusing on containment and mitigation and management. And in my opinion, there's absolutely no way that we can move forward, even as the state begins to reopen, and we don't know exactly when that's going to be, in a manner that allows for the same types of turnover of people incoming and outgoing on the Outer Cape. So that means, you know, the volume of people that would come and leave. So 3-day short-term rentals, it can't happen. Contact tracing can't happen under those circumstances. The select board's going to have to make some sort of comprehensive planning decisions about how to address these things in a way, and it's going to be difficult, and there's definitely going to have to be restrictions on short-term rentals. We cannot have that kind of volume of people coming in and out. If somebody's here, if there's some coastal communities in New Jersey that have restricted short-term rentals to a minimum of 30 days. If you think about what that means that one unit is occupied by the same group of people for 30 days. That same unit at 3 3-day rentals could have been occupied by 10 different groups of people coming and going. And so when it comes down to it, these issues are difficult, but we have to address them now. And Memorial Day weekend is far too close to be, in my opinion, allowing short-term rentals. And anyone who thinks that people aren't going to come because this is pandemic only has to look at what's going on in P-Town right now to understand that people are going to come. I've wanted to even, take a trip to get out of here just because you get sick of being cooped up where you are. And I'm in a vacation paradise here, and there's people in shoebox apartments, there's people all over. And when the state sort of reopens, we can't handle that kind of influx of people, and there's no possible way we can contact trace that kind of incoming and outgoing. I mean, if you can imagine things the way they are, with our population remaining the same, the idea of containing and mitigating and managing this pandemic seems highly possible. And when you sort of take that and then add, you know, probably 100,000 people come in and out of the Outer Cape every week in the summer. So when you put that in the mix, there's just no way we can possibly contain or mitigate what would become another emergency where we'd need emergency response. So I'm working on a few things to put forward to the select board and hopefully to the other communities as far as actual policies that sort of make sense in a comprehensive way to sort of mitigate that kind of thing. And we'll be relying on, you know, members of this emergency response group, probably the fire rescue, health department, and police department, and DPW to sort of look over those things. And then hopefully those can go to other towns also. I've been in touch with some select board members from other towns on the Cape to see where their thinking is. And everyone sort of seems to be on the same wavelength with this. The fears exist in all towns. And the idea of sort of preparing for things to just happen the way they would naturally happen doesn't seem reasonable to me. We need to mitigate this. So
Can I just chime in for 1 second, Mike?
Sure.
I don't know if any of you are in touch with Sean O'Brien. He's the director of Barnstable County Department of Health and Environment, but it seems that he and some other folks have a Cape Cod reopening task force. I haven't heard too much about it. I'm going to hear about it this afternoon, but it might seem relevant to reach out to Sean and see what they're planning on putting together and who's in that group.
that's great. What's his name? I could get in touch with him.
Sean O'Brien, he's the director of Barnstable County Department of Health and Environment, and it's called the Cape Cod Reopening Task Force.
Keep falling.
Okay, that's all I had to say. I just had to get that out.
We have a lot of questions in the chat and in the email, so if we can get to those sooner rather than later, that'd be appreciated.
Okay. But Chief Polly, about what Mike just said, you know, it would be better if we could, as a select board, have that gentleman come to one of our virtual meetings and tell us, or somebody from that group, and report to all of us about this. That's all. Thank you.
All right. Professionally, so we'll reach out to him. I know there are lots of questions. I'm going to ask though, just for one brief update from the library, because I know Jennifer wanted to say a couple things, and then we'll go to the questions.
Hi, thank you. I just wanted to say that along with all the libraries from Orleans through Provincetown, we are working on a phased opening plan together, because we all have the same patrons that visit our libraries, and it just doesn't make sense to have different plans, because one library would be swamped if we had different plans. We're also all talking to our town administrators and town managers to make sure that these plans are okay, our boards, etc. And we're worried about what you're all talking about, the mask situation. How do you enforce that if somebody walked into your building, etc. We're worried about the short-term rental situation, having a new group of people every few days coming through the door, and how that would affect our staff and the public that are coming into the building. We're also waiting for guidelines from the state on the safe handling of materials and the kind of PPE that our staff would require to handle these materials, and to quarantine them in between the use of each patron. We will definitely be doing a very massive curbside type of situation this summer. And we're still working out all of the kinks in that, but that will happen. I've talked to Jane Norton about what cleaning our building would look like during this time. And that was great. And I very much appreciate that. In terms of what we're doing, look at our homepage. We have 2 new services. One is called Hoopla. It has music, movies, television programs, books, ebooks, comic books, graphic novels. And we also have the New York Times, and you can get both of those with your Wellfleet library card, as well as all of our other services. If you do not have one, or if you have problems with it, please call 508-514-1483. I'm always here to help you. Our Seeds by Mail is ending this week, and we are currently curating a digital art show for art that people are making during this time. It's called Isolation Inspiration. And this Friday is when all of the art is due. You will see on our website instructions for how to submit that. And then in the future, we'll be doing other curated art shows, as well as literature, music, and all sorts of things from people in the community to kind of showcase what kinds of things they're making during this time. And I will be in touch with you more about what's going on. And first and foremost, we're thinking about safety, and we're working towards our robust summer schedule and moving as much as possible to an online format, and just trying to figure out how to rebrand that for this summer. Thank you.
Thank you, Jennifer. Courtney, I think you said we have a number of questions.
Yep. So for Chief Hurley, what does the face covering directive mean with respect to enforcement over public roads for cars, trucks, motorcycles, bicycles, joggers, and walkers?
Right now, working with Hillary and speaking with her, again, the spirit of the order, and again, if you listen to a quick snippet of the news, it's not we encourage face coverings at all times if possible, but when people are going out and they're keeping social distance, that's not the spirit of the order. So, we're working with Hillary on how to address the complaints, and working with her and the Board of Health on the enforcement mechanism right now. I mean, all that I would ask, and I was going to mention it briefly earlier, it's stressful for all. We're trying to strive for 100% compliance, but by no way are we going to probably achieve that. So, I mean, this past weekend, like Dan was saying, I mean, it's disheartening at times. However, the uploading of photos to social media and causing more stress and anxiety in the community, which then results in quite a number of phone calls to our department. And, talking to my staff this past weekend, it was quite an uptick of some hostile phone calls. I mean, I understand the frustration that's out there, and I also will just end it by, I don't think it's the spirit of the community for, the police department to be going around as the sole enforcement mechanism. We want to be part of the solution, but we want to do it safely and also reasonably. I think education and reminding and self-responsibility.
Okay, thank you. The next question is, will it be safe to swim in the ponds? Hillary, Suzanne, do you want to take this one on?
We believe it will be safe to swim in the ponds. We know that the UV light from the sun does degrade the virus. I think the bigger concern is keeping that social distance while swimming. We are still reviewing research on the subject, and will continue to do so.
Thank you. The next question. Dan, can you maybe answer this? Can Wellfleet institute a ban on short-term rentals even if the state lifts its current ban? I think we can reference back to earlier in this situation when Provincetown gave stricter orders than the governor did, and they were told to rescind them. But Dan, if you have any opinions or thoughts on that, please let us know.
Wellfleet does have the option. We checked with town council to see if Wellfleet, if the town wasn't comfortable with what the state directive was, Wellfleet has the option of being more restrictive than what the state is. We do not have the option of being less restrictive. So we do have the option of making decisions that are appropriate for Wellfleet.
Okay, thank you. That's all I'm seeing right now. Mary Ellen, if you still have a question, I will unmute you.
Oh, hi, thank you. Dan answered the previous question, and I wondered, Hillary, if you had numbers of the number of how many COVID cases there were on the Outer Cape. I could check each town's website, but I just thought you might know.
I don't know that anymore. The numbers are posted town by town weekly on the DPH website, so I would direct you there. You'd probably get to it before me.
Okay, and we have just, Wellfleet, I guess, has just 4 cases?
I believe we had a 5th case and we only have 1 active case at the moment.
Okay, thank you very much.
And this is going to be the last question. To keep social distancing, has the town considered timed entry at ponds and beaches? Suzanne?
I don't believe we've discussed that yet. This is Hillary, not Suzanne.
Thank you.
Okay, is that all you see there, Courtney?
That's all I'm seeing. Let me check the email. Yep, that's all I have.
Okay, so it's 10 minutes after 11 on Tuesday. Again, I'd like to thank you all for being here. We do appreciate you listening and the good questions. And we will see each other via this format or this platform again next Tuesday at 10 o'clock. Everyone stay safe and take care of themselves.
Thank you.
Thank you, Chief.
Thank you.